We start. Yeah. Hello. Um, well, the subject of this roundtable is suicidality in profession, or suicide, profession suicide-related suicides. Um, we start with Mr. Petsas. Mr. Petsas?
Okay, thank you, Ms. Sakidu, for the introduction. Thank you for being here. I'm here to talk about suicidality among health professionals. So I will start with some interesting words. A neurosurgeon said some time ago in Thessaloniki. So he said, I remember when I entered medical school, I just wanted to be the best, to save the lives of all my patients, to save the world. I would not become like the others I disliked. The rigid ones, those who neglect, the tired or the fed up ones. So time went by and I got tired. Everybody wants a piece of me. All these patients, all those people. I don't care anymore. I don't care whether they live or die. Finally, I became one of those guys I didn't like back then. Being a doctor is a difficult thing. Being a health professional is a difficult thing. So, as the Lancet editorial described in November 2009, physicians today live and work in a technocentric, dehumanized, and financially driven environment, often within a broken and unjust system of healthcare, a shrinking safety net, more indigent patients to care for, and increasing competition for research finding. In different settings worldwide, physicians may work under conditions that increasingly prevent them from living up to their highest ideals. In this pretext, suicidal among health professionals cannot be something that would make us think that it is something rare. On the contrary, there's an increased suicide rate in physicians compared to the general population. There's an increased prevalence rate of depressive disorders, job-related stressors, and even substance abuse among physicians. There's a very interesting research made in Australia between years 2001 and 2012. The conclusions were that suicidal rates for female health professionals were higher than the women in other occupations. Suicide rates for male medical practitioners were not significantly higher than for other occupations. Suicide rate for male nurses and midwives were significantly higher than for men working outside the health professions. The suicide rate for health professionals with ready access to prescription medication was higher for those in health professions without such access or in non-health professional occupations. And the most frequent method of suicide used by health professionals was self-poisoning. As we can see here, what are the ways that medical practitioners commit suicide? The first one is hanging. The second one is self-poisoning. Here is carbon monoxide, firearms, other methods, and not recorded methods. We see that in medical practitioners and midwives and nurses and in other healthcare professionals, we have a very big degree of self-poisoning. The interesting thing is that in other occupations, self-poisoning is very low and hanging is very high. So the fact that we have access in drugs makes it very dangerous for health professionals to commit suicide using this method. So another research made in Australia. I know that there are people from Australia here, so I know they do a very good job. In a total of 404 drug-caused deaths reported in 10 years of people, healthcare professional persons. In these 404 people, there were included medical practitioners, paramedics, nurses, dentists, psychologists, pharmacists, and veterinarians. And females were the two-thirds of the cohort. The highest number of cases involved nurses, in a very huge percent, and medical practitioners, but the mortality rate was highest among the veterinary group. So the veterinary physicians are not as many as nurses, but the mortality rate was highest among them. Most were intentional self-harm deaths followed by unintentional deaths. Mental illness was common, diagnosed in almost half of cases, with the majority involving depression. And a number of cases report additional stressors such as relationship, workplace or financial issues, and drugs. It's not only about doctors, of course. It's also about nurses. So there's a high prevalence of suicide among nurses because of the high stress and distress or the psychiatric problems that nurses experience. And it's not only about nurses or doctors committing suicide. It's also about experiencing the deaths of other people. This death can be due to suicide, or even a sudden death, or even a death in the very everyday program of a clinic. It's very difficult for people to deal with death, and it's very difficult for people who work with people who are dying. And the nurses are prone to encounter completed suicides. The rate of nurses who had encountered patient suicide was 55% at this research of Takalashi, which was made in 2011. The proportion of respondents at a high risk for post-traumatic stress disorder was 30.7%, but only 50.8% of respondents indicated that they had access to post-suicide mental health care. I just want to say that in Greece this percent is 0. So, what about dentists? Is this a myth or reality? From what I tried to find, there were many controversial results. But at the end, the conclusion for me is that in the literature we find many cases of many research studies that indicate that among dentists there's a high percentage of suicide of people, of colleagues who commit suicide. And the reality is that we're not perfect. We're not doctors and health professionals. We're not invincible. We might think that we are, but we are not. So physicians may face unique impediments to attending to them. Self-care among physicians is not a topic generally included as a part of professional training. This is a very big problem. Self-neglect can lead to tragic consequences, and we health professionals neglect ourselves. In some areas, particularly suicide rates, physicians have increased vulnerability, and in other areas, problems may be unrecognized as such, problems such as depression, substance abuse, marital problems, and other stress-related concerns. So, the risk of physicians to commit suicide. Physicians seem, according to this research, physicians seem unwilling to deal with their own suicidal problems professionally. Suicide is a repressed topic. We are not allowed, or we don't allow ourselves to deal with this. According to international studies, medical students and physicians are clearly overrepresented among suicide victims. Committing suicide stands in sharp contrast to the positive image physicians enjoy as competent, strong helpers transmitting positive energy. So we're obliged to be strong. We cannot be nothing else but strong. Various studies and meta-analyses show that physicians use knowledge specific to their profession and are therefore more successful than the general population in committing suicide. We know how to kill ourselves, in other words. The data reveal a number of risk factors specifically correlating with medical practice. This is confirmed by an increased number of suicides during medical training and professional life in comparison with the general population. Gender-specific analysis show an even higher suicide risk for female physicians. This is the strongest data above all. In this context, it cannot be excluded that out of professional respect, cardiovascular causes of death are sometimes falsely documented in death certificates instead of suicide. Despite their special education, physicians are not very good at diagnosing their own emotional disorders and asking colleagues for adequate professional help. They rather tend to camouflage their own psychological problems, also because they are afraid of occupational and personal discrimination. Matter of life and death in a metaphorical way. Almost 1/3 of the neurosurgeons get a divorce. It's not only about committing suicide. It's not only about dying in a somatic way, but also in a mental way. And it's not only about life. It's only about life quality. And getting a divorce is not the best thing for everyone. 1/3 of neurosurgeons getting a divorce is a very bad thing. It shows a lot. So when the cause of death is cardiovascular disease, a car accident, and suicide, doctors are represented more than any other university graduates. We said before, all three of them are related to stress. And many car accidents are not accidents, they're suicides. So about occupational stress in health professionals, this is in a complex relationship with temperament and hopelessness, and also common among healthcare professionals, as this research says in 2013. What about burnout? The percent of the doctors is between 25 and 60%, as this research says. The doctors in Greece, 52%, as Panagopoulou and Montgomery research in 2012 says. And what about nurses? 67%. More than this, 48 of the internists and 40 percent of the neurologists report experience of verbal attack by their superiors. 25 of the doctors, at least once, have a violent behavior towards nurses. What about the medical errors? I mean, these are conditions which may lead, which may contribute to committing, which may contribute to the appearance of depression or mental illnesses, and they lead to suicides. What about the medical error? Medical error is an unintended act, either of omission or commission, or one that does not achieve its intended outcome. The failure of a planned action to be completed as intended, an error or execution. The use of a wrong plan to achieve an aim, an error of planning, or a deviation from a process of care that may or may not cause harm to the patient. There have been incidents of doctors committing suicide because of medical errors. Do you agree? Oh, that's not translated. So I will translate it now. All the humans often make mistakes. Systems that are based upon the absence of the possibility of making a mistake are doomed to fail. So, do we agree that the health professionals have the right to the medical error? Or don't we? We can discuss this later. So, about the high-risk occupation for suicide, veterinarians were ranked first at this very interesting research in 2013. Pharmacists 4th, dentists 6th place, doctors 10th, and farmers 13th. Those categories have easy occupational access to a method of suicide, pharmaceutical or guns. The interesting thing is that by 2001-2005, there had been large, significant reductions in suicide rates for each of these occupations, so that none ranked in the top 30 occupations. This is very optimistic. This is shown here. So those categories, veterinarians here, hospital porters, okay, dentists, doctors, they're under the position 30. So with this optimistic result, which is on the other side of the first results that I showed you, I'd like to thank you for your being here, and that's all.
Thank you, Mr. Petsas.